Good morning, students. I am Dr. Harpreet, and with me is Professor Sudhir Kumar. We'll be talking about how to go about a Perthese disease patient in your examination. Good morning, sir.
Very good morning. Yes.
So, this is a common long case which is given to you in your exam. At the end of your history taking, you'll be asked to summarize what are the salient points of your history. So, sir, what all the examinee should say as a salient points in a case with Perthes disease?
Um, Most of the time, a patient of a Perthes disease is a young boy, normally somewhere between 6 to 10 years of age. And parents bring the child because he's been having a limp. They've been observing limp on the child, which is almost painless. They say, well, he runs about, but he's limping on that side at times, and otherwise the patient doesn't have any problem. So normally your patient will present to you with a painless limp, and in relatively advanced stage, the patient may also be complaining of a restriction of movement in sitting. So the most important aspect is painless limp and restriction of movement in sitting position or a cross-legged position. And for such patients, you got to take history. Most of the time comes from the parents that this child had no problem, this child was okay, he had no history of any major trauma. But you see, normally the child keep on falling here and there, and that may attribute to their problem. And they may relate at times, the parents may relate the limp that, well, this fellow fell down while playing maybe 2-3 months earlier, or they may relate it 5-6 months back. So they may relate their history of limping with the trauma, which was not very significant in their mind because the child did not get any fractures. But at the same time, you got to know about any negative history, which you need to ask whether the child had any prolonged fever or inability to move his hip during the neonatal period. Because in neonatal period, may not have fever at all, and the patient may have just inability to move the hip joint or a swelling around the hip joint. By giving over an antibiotic, that it might have resolved over a period of time. However, any history of infection in the joint must also be elicited, and history of a significant trauma. But you see, at times the patient can have significant trauma and may have a fractured neck of a femur for which he has been operated. And that may also result into a delay in the maturation of the epiphysis of the femoral head. And that may just present to you like a Perthes. So what you call as a Perthoid disease. So hence, if you know the natural history of the major trauma taking place in the early childhood or during 5 to 6 years of age, then you can visualize what could have happened to your patient. So this is just to exclude out that it is a not purely a relevant avascular necrosis, but it's a Perthes disease where the patient may just present to you with a painless limb. So, classical history that the patient has in Perthes disease is painless limb to start with. Painless limb to start with.
So, painless limp would be the classical history, and patient would also have a history of restriction of movements, like sitting in cross-leg position. Remember to take your negative history to rule out other possible causes of a limp at that age.
At times,